Good morning, everyone. Good afternoon, everyone, and good evening, everyone. Why I'm saying all this? Because we have such a big network. Our family is so big that my students living abroad, they are some are in morning time zone, some are in evening, some are in afternoon. So a very warm welcome. Good morning, good afternoon, good evening to everyone from MAHSA University. I'm Ashutosh. I'm back here again from Faculty of Pharmacy, MAHSA University, Bandha Sojana Putra, welcoming all of you in our another session of webinar where we will be talking about another interesting topic. By the way, it's a very nice weather here outside. I can see through my windows. Really cloudy, cool weather. I hope you all are enjoying at your home too. So, for today's session, I would like to introduce our speaker of the day. Yes, we have a guest speaker who will be talking about this interesting topic, right? And you know what the interesting topic is, right? The non adherence to medication. So, our speaker today, Mr. Kadir Muhammad Kadir Rizwan, I'm welcoming him. He is the speaker for today. Mr. Kadir Muhammad is a lecturer at Faculty of Pharmacy, tremendous experience in field of clinical pharmacy. Yes, he's a clinical pharmacist and registered with KK Malaysia. He has completed his clinical pharmacy training from Cyberjaya University, his post graduation. Further, he honed his research skill, his clinical expertise in therapeutics, respiratory system related therapeutics, and under the geriatric population. So you can have a lot of questions in your mind to ask to him. So anything related to medicine, you have a clinical pharmacist in front of you today from MAHSA University to answer all of your queries. So I would request Mr. Kadir to please introduce yourself a bit and take over the podium. The audience is yours.
Okay, thank you so much, Mr. Ashutosh. So, Bismillahirrahmanirrahim. Assalamualaikum to everyone. I think what Mr. Ashutosh says is correct. So, we have a really good day today. So, I'm Kadir Muhammad. So, I'm the lecturer from the Department of Clinical Pharmacy, MAHSA University. So, I'll be talking about a little bit of non-adherence to medications. Okay, so let's go. Let's see what is actually non-adherence to medication all about. So before I proceed, so let's see on an introduction to MAHSA University. So introduction a little bit to my university, which is MAHSA University. So MAHSA, which stands for Malaysian Allied Health Science Academy, and it was founded in 2004 by our great Professor Tan Sri Dr. Haji Muhammad Hanifah, who is the Pro-Chancellor and Executive Chairman of MAHSA Group. Professor Dr. Hanifa is a clinical practitioner of medicine whose vision involves the creation of a stronghold academic excellence in the fields of medicine, biosciences, dentistry, pharmacy, health sciences, nursing, business, finance, hospitality, management, information technology, and engineering in the Southeast Asia region. This vision to produce qualified and compassionate professionals to serve the needs of our nation is in line with the Prime Minister's vision that Malaysia should become a center for academic excellence. The new 48 acres campus, which is stated currently where we are working, which is Bandar Sarjana Putra, which is in Selangor, is the embodiment of that vision. Today, MAHSA University has from 75 different countries, and not just from the region of Asia, but far as Australia, United Kingdom, United States of America, and also Canada. Moving into the second decade of the 21st century, MAHSA envisions to lead research and innovation in the areas of its expertise that is driven by the demands and capabilities of IR 4.0 as shown in the outcomes of its past research initiatives. MAHSA believes also in being more, and their Be More maxim drives their strategies and plans towards an education that is beyond classroom and textbooks and towards the cultivation of professional skills that will allow its graduates to be fully equipped for the years ahead through MAHSA's Passion to Success, which embodies pride, stands for Professional Industry Ready Education, and MAHSA Masterclass Series, regardless of what field of study they pursue. MAHSA University is awarded online university by our Ministry of Education. So this has allowed our university to provide borderless education to many MAHSAs, engage learning experience and innovative teaching, elevate, which brings an education that goes beyond the limits of physical expectations. So we can do an open and distant learning throughout the world. Okay, a little bit on our own faculty, which is Faculty of Pharmacy. So on the right hand side, you can see our Dean. So our beloved Dean, Prof. Dr. Zoria Aziz. So previously she was a Dean from University of Malaya. So for Faculty of Pharmacy, actually we do have 5 programs under Faculty of Pharmacy. First one is PhD in Pharmacy. Second one is Master in Pharmacy. Third one will be Bachelor of Pharmacy. Fourth is Bachelor of Science in Pharmaceuticals Technology. And the last one will be Diploma in Pharmacy. As for now, we have the current batch for Bachelor of Pharmacy. We have currently around 54 students, and for Bachelor of Science in Pharmaceuticals Technology, around 3 students. Okay, so without further ado, let's see our main topic, which is the non-adherence to medication. So first of all, we need to know the definition of non-adherence. So non-adherence in the healthcare, it will result that the patient does not initiate or continue care that a provider has recommended. So provider in simple terms will be your doctor, your physician, or even your specialist. So this happens whenever the patient will have some restrictions where they might have issues to continue the care that their provider has been given throughout the medication therapy. So for example, they need to use antihypertensive for a duration of 6 months. So they need to refill their medication every 1 month, because these have been practiced in the government hospitals. So government hospitals can only provide 1 month of supply. So the next month, maybe the patient didn't come. So we'll see what are the reasons for non-adherence. So adherence definition, according to the WHO World Health Organization, it defined adherence to long-term therapy as the extent to which a person's behavior in terms of taking medication, following a diet, and or executing lifestyle changes corresponds with agreed recommendations from a healthcare provider. So in our context as the medical provider or as a pharmacist, we are going to focus more on the patient's behavior or the person's behavior on taking medication. So we need to know how many tablets are the patient taking, so for a duration, for what kind of duration, is it for 1 week or 1 month. So these are all our concern for the particular patient. Okay, some of you might previously heard the term adherence, and some of you might only hear the terms for compliance. And some practitioners use non-adherence, some of them use non-compliance. Just to differentiate between adherence and compliance. So first of all, let's see adherence. So definition of adherence is the act of filling new prescription or refilling prescriptions on time. Like I said previously, if your duration of treatment is 6 months, so every other month means for the first month, once your medication has finished, so the next month you need to go again to the pharmacy in the government hospital, for example, to take your new prescription. So second one is compliance. The definition of compliance is act on taking medication on schedule or taking medication as prescribed. So if you can see, there is actually difference between adherence and compliance. So for compliance, it is more on the therapy for daily, for example. So for example, you need to take your antihypertensive daily twice. Means you need to take in the morning and maybe in the evening. So non-compliance can happen if the patients only remembered to take the dose in the morning or the dose at night or in the evening. So they might miss one dose. So that is can be considered as non-compliance. So what are the risks of adherence? So first one will be reduced functional abilities. So if the patient is having diabetes, so let's just change the type of disease. So patient is having diabetes. So if they don't take their anti-diabetic medication, for example, their insulin. So if they don't take their insulin, so they might have this hyperglycemia. So signs and symptom of hyperglycemia will not make their daily activity that normal like usual. Okay, second point is additional of medication cost. So now you are not taking your medication properly. So we need to treat the other things that might occur, which is some of the consequence for the current chronic disease. So for compliance, what are the risks? If you are not taking it properly, first one will be increased hospital stay. So this might increase some of the costs. And second one will increase the risk of morbidity and mortality rate. Okay, what are the medication adherence tools that we can use as a pharmacist just to check whether the patient is taking their medication according to the prescription given by the doctor? So medication adherence can be measured using direct and indirect methods. So first example will be the direct methods. So under direct methods, we can watch the patient take every dose of the medication. Let me give you an example. Okay, if the patient is on, okay, let's say patient is having HIV, so they need to take a few drugs to control the HIV itself. So patient on HIV drugs, we need to remember that the virus might have caused resistance if we don't take it properly according to the proper time. So let's say the patient need to take three kind of medication, which is HIV related drugs. So the patient itself will come to our pharmacy and we will see whether the patient is taking the medication or not. Same goes in some patients who are on anti-TB drugs. TB is tuberculosis. So we need to see whether the patient is taking the drug properly or not. Since we might afraid the case of resistance, okay, resistance will occur if the patient doesn't complete the course of antibiotics. So the doctor will give you a course, let's say 1 week, but the patient only take around 4 days. So they miss 3 days. So the bacteria or virus, they are really intelligent, they are smart. So they will always find a way just to make sure that your medicine that you are going to take, they will just make some things, maybe they just replicate the DNA structure, RNA structure, just to make sure that they can cause resistance. Okay, so that is for watching patient taking every dose of medication. And second one under direct method is to measure the medication level in the blood. So as a pharmacist, we have our own department, which is the Therapeutic Drug Monitoring Department, which is the TDM. So every now and then, if the patient, let's say patient is on digoxin, which is one of the cardiovascular drugs. So cardiovascular drug, digoxin has a really narrow therapeutic index. So narrow therapeutic index means if we increase the dose slightly, we might afraid it goes to toxic level. And if we reduce the dose a little slightly, it might goes into the subtherapeutic level. Means it doesn't shows any effect that it should give out. So this is being done in the TDM department where we will withdraw the patient's blood and we will check the plasma level. So means we can measure where the patient is actually taking their medication by the level that is available in their blood system. Okay, so for the second one will be your indirect method. So we can conduct surveys or even asking the patient to write diary. Okay, diary in such that if the patient is taking this medication that particular day, so patient needs to write down, okay, for Monday, they are taking at 8 a.m. and the list of medication that they are taking. So patient self-report. So we can also ask the patient whether they take the medication for that particular day. Pharmacy refill rates. Okay, this is our job as well as the pharmacist. So we can know from the pharmacy refill rates whether the patient is coming regularly, means every month are they coming on time or not. If the patient having balance at home, so means the refill time will might be varied. Okay, pill counting. So we will ask patients sometimes just to bring whatever pill that they have at home. Monitor for clinical response. So we can also see the physiological of the patient. So we can see whether the patient is okay or not by the clinical response. And the last one is electronic data, where we will keep all the data of the patient, the numbers of medication that they have taken previously in the system. Okay, so let's see what are the prevalence of medication adherence. So according to WHO 2019, in developed countries, adherence among patients with long-term disease, or we can say chronic disease such as high blood pressure, average at only 50%. And this figure assumed to be worse in developing countries. So if you can see, only half of the patient is adhering to their own medication. Means another 50% of the population is not taking their medication properly. And it is assumed to be worse in developing countries. We might believe that one of the maybe drawbacks for developing countries is the availability of clinics, health clinics, and maybe they might need some amount to buy the insurance card and so on. So for point number 2 in Malaysia, good adherence to high BP or high blood pressure medication was found to be 53.4. This is a research done in 2012 by Ramli. And the study shows that 2 years after hospitalization for acute coronary syndrome, example heart attack or unexpected chest pain, only around 40% of patients continue taking statins. So statin is a type of cholesterol lowering medication. So to those patients who have acute coronary syndrome, where do they have heart attack or stroke? So as a pharmacy, we will provide them with these statins. So statins, according to clinical trials, it showed that it will help to prevent from any heart attack or any unexpected chest pain to occur in the future. Okay, so long-term disease related with non-adherence. So it is the main cause of failure to control your high blood pressure is by poor adherence. Means your high blood pressure, what is your BP levels? Okay, normal person or normal individual, their BP level should be around 120 over 80 millimeter mercury. But in case of patient with underlying diabetes or underlying heart failure, or even they do have their own hypertension cases, so the clinical experts has come out with our own guidelines, so clinical practice guidelines. So this different type of individual will have different kind of range. Means what will be the target range? So now let's say our target range is 130/80. But if you have poor adherence and every time you are coming to the clinic or in the hospital, you are having really high blood pressure up to 170, 180, okay, just bear in mind if your BP, systolic blood pressure, it goes up to 180 and above, we might afraid hypertensive emergency might happen. So chances of having any end organ damage is really high. Okay, so it is estimated that poor adherence contributes to poor blood pressure control in over 2/3 of the people with high BP. So it shows that only 1/3 of the population have good adherence to the blood pressure drug. So rates of uncontrolled BP, blood pressure, diabetes, and cholesterol in Malaysia. So high blood pressure, so only 35% of patients achieve their target blood pressure while on treatment. So this is from our Ministry of Health, dated 2013. So if you can see there, only 35 means remaining 65 doesn't have proper BP control. So once you don't have a proper BP control, we might afraid that it might cause another kind of disease. Okay, so bear in mind, if you don't have proper BP control, like I said previously, you might have this issue of hypertensive emergency. So let's say hypertensive emergency and it cause you your kidney to have an injury, which is an organ damage. So now we need to treat your kidney. So we are having two things to treat in one time. So diabetes in government health clinics, only 23.8% of patients with type 2 diabetes mellitus achieve the national HbA1c target. Again, it is less than 30%. Okay, to those diabetics out there, I know that every now and then, if you are going for follow-up, so sometimes the doctor asks you to fast in the morning. So it will consider that as a fasting blood sugar or fasting blood glucose. And maybe sometimes they just randomly take. So it is considered as random blood sugar or random blood glucose. But both of them, the patient can actually sort of change the reading by, okay, if you are having high amount of sugar, it can be maybe from the diet itself. Maybe the patient is consuming a lot of sugar previous night, or it can be from patient doesn't take their medication. So it can be very between those two. But this HB1AC, because it is relating to your red blood cells, so actually there is some glucose that will bind to your red blood cell. So this one you cannot alter. Means if you are having up and downs, means yesterday you are taking your medication, tomorrow you are not taking. So this HB1AC can be a true guide for us just to see whether the patient is adhering to their medication or not. So high cholesterol among patients with type 2 diabetes, so only 28.5% and 37.8% achieve target cholesterol, and their LDL, which is their low density lipoprotein, which is also known as the bad cholesterol. Okay, let's go to the most important thing, why people miss their medication. Okay, so first of all, the medication is for a disease for which they do not experience any symptoms. For example, high blood pressure or high cholesterol. Okay, um, not to generalize, but some practitioners, they do prescribe drugs without the pure indication. So maybe you just have hypertension. Okay, so hypertension, they will give you hypertension medication, and then they will just give you also statins, which is they will say, okay, sir, actually you have high cholesterol. So then they will provide you statin. But actually you don't have high cholesterol, only you have the hypertension. So this is meant by the medication given is not for your own symptoms. Okay, so number two will be lack of understanding of the disease itself. Okay, this will usually happen for patients that are pediatric patient, small children's, even those elderly patient, geriatric cases. Okay, they don't understand their disease. So we as a pharmacist, we really need to explain in layman terms, okay, um, in such that we can use really jargon words that after that they won't understand. For example, if patient is having diabetes mellitus, so we need to say that they will have high amount of sugar in the blood. So if you were to explain, let's say, okay, so actually you're having this term of hyperglycemia, so not all people will understand the term hyperglycemia. Okay, even though nowadays we can just Google up what is actually hyperglycemia, but every now and then we need to know that we always need to have the human touch, human to human contact. So if they can rely on Google, why do they need to meet us? So we as a pharmacist, as the human, giving human touch, so we need to explain really in detail by using the layman terms where they can understand easily. Okay, so for point number 3, forgetfulness. Okay, elderly, this is common in elderly. Okay, some patient might have dementia, Alzheimer disease, where they do forget to take their medication on time. Okay, this can also happen in normal individuals, healthy human, not to say healthy, normal individuals who are working, who might need the use of antihypertensive medication just because they are busy working. Okay, they might forget their particular dose. So forgetfulness is point number 3. So point number 4 is misunderstanding or confusion on instructions. Okay, in some medication, we need to know that on your medication there will be a special label. So we'll see there is the medication name, there will be the dose, okay, when you should take, is it before or after food, okay, and the side effect, maybe drowsiness. Okay, so confusion can be seen if, let's say, we have 4 types of medication. 2 medication need to be taken before food and 2 medications need to be taken after food. So patient might confuse, okay, all medication after food or all medication before food. So that's why sometimes we need to explain the patient until they do understand, or even we can assist them maybe by putting some extra labels, okay, maybe tag the medicine packing, the envelope itself, maybe before food we can just tag it with a yellow color, after food with a green color, so just to make it easy for them. Okay, so for point number 5, not convinced that the medication is effective. Okay, so to patients out there, you need to really remember that whenever you are taking the medication, it needs to go through your stomach first, then it will need to have the breakdown process before it can be absorbed. So even though after being absorbed, after it is being available in your bloodstream, we need to achieve the target range or the target level that the medication will start to show their effectiveness. So always be patient, okay? Some medication I know, for example, paracetamol, we do have the active fast, so it can act really fast. So that's why you can see the effect in maybe 30 minutes, okay? To compare with anticoagulants, to those heart patients taking anticoagulants, so anticoagulants can only show effect maybe 1 or 2 days. And patients who are taking those who are having depression or even schizophrenia, so all these CNS drug will take around 4 weeks to show its true effect. So please see again your medication, they have their own onset for effective, to become effective. So number 6 is unsure if the medication is working. So actually it relates back to point number 5. Okay, so number 7 will be presence of side effects. Okay, there are also, you need to know there are intended side effects and unintended side effects. So intended side effects are like your antihistamines. So antihistamine you are going to take whenever you have any allergy, or if you have runny nose. So you will take this antihistamine. So antihistamine, the Piriton, the brand name Piriton, or known as chlorpheniramine, 4 milligrams. If you are taking Piriton, you might have this drowsiness. So drowsiness is actually intended side effect just to make sure that the patient can really sleep good at night. Okay, if you are having runny nose, I believe that most of the patient doesn't have a good night's sleep. Okay, compared to unintended side effects, okay, maybe you will have to patients who are taking inhaler, salbutamol inhaler. Okay, so you can see there is an increase in heart rate. Okay, all of a sudden you will start to having tremors. Okay, so that is the unintended side effect. We don't want that to happen, but because we are focusing more on the true effect of the salbutamol, which is to expand your lungs, so that is the main point. So this unintended side effect, which is having tremors, increase in your heart rate, it will go off by few minutes to hours. Okay, it depends on the dose. Okay, so number 8 is fear, such as medication dependence or side effects. So side effect, it relates to point number 7, and medication dependence. For example, patient having rheumatoid arthritis, so they are taking NSAIDs. So NSAID is sort of like a painkiller. So they might afraid they might depend on the painkiller throughout life. Okay, because just they are having rheumatoid arthritis, they need to take it every now and then. So they might sort of believe they might need to depend on that one or going to abuse after some time just to treat the rheumatoid arthritis. Okay, so the next point is duration or complexity of treatment. Okay, this is common in chronic patients. Okay, you need to know once you have diabetes, once you have hypertension, so the treatment is, you can see throughout life. So duration of treatment will be long. Okay, we will monitor from time to time just to ensure, let's say if you are having diabetes, so we'll ensure your blood glucose to always be at the normal level. So complexity of treatment, some hypertension patient, we need to have a few types of medication to combine with. So these combinations might be a little bit complex to some patient. Okay, different kind of medication will have different kind of mechanism. So that's why maybe you just have hypertension, but you need to take 2 or 3 medication. Okay, next one is having to take medication multiple times a day. Okay, this is common in penicillin antibiotics such as cloxacillin. Okay, cloxacillin, you need to take cloxacillin if you have any skin infection. So cloxacillin dosing, there is 3 times a day and 4 times a day. So if you are taking 4 times a day, it's not easy for some patients to take it 4 times a day. So 4 times a day, normal dosing, we will advise the patient is 6 in the morning, 12 in the afternoon, 6 evening, and 12 midnight. So that is might be a burden to the patient because of the multiple times a day dosing. So next one is difficulty in taking medication. Patient might be confused of the use of injection or inhalers. Okay, so if you are taking pills and tablets, I think it will be easy. You just take a glass of water and just put in your mouth and swallow. To compare if patient need to use injection, okay, injection such as insulin or inhalers in patient with COPD or asthma. So we as a pharmacist, we need to really explain in detail what is insulin, how we are going to use the insulin, okay, which site of injection we need to use. Okay, let's just see in the example of inhalers. Okay, we do have different type of inhalers. Okay, metered dose inhaler, we have the acute inhaler, turbo inhaler. So I can put list, it will go a lot type of inhalers. So we need to see the patient itself before we are giving them inhalers. Even babies, they do have asthma. So they cannot use the normal inhaler, which is the metered dose inhaler. So for them, we need to provide with the, what do we call the aero chamber. Okay, so we need to provide with aero chamber because they don't have the hand-eye coordination. So this is just to ensure that the dose given just to treat the asthma is being at the full 100%. Okay. So poor relationship between the patient and the healthcare professional. Okay, this might happen in clinics or even pharmacy where the patient and the healthcare professional doesn't have really good rapport. Okay, let's say the patient came in with maybe depression. Okay, so let's say the patient is having depression. We as a healthcare professional should become more empathy to the patient. We need to understand the patient, then we need to really give the medication that is suitable for them. So if we as the healthcare professional, patient is coming in with depression or even schizophrenia, and we are being judgmental to them, so it shows that we as a healthcare professional, we do fail that part. So healthcare professionals should have empathy in them, where we do understand their feeling. So from that, we can build a really good rapport with the patient. So once the patient likes you, so they will continue to come to your place, whether your pharmacy or even your clinic. So miss appointment with doctors. Okay, maybe patient is staying far away. They are staying in rural areas. They don't have access to public transports. Okay, I've seen a case where a geriatric patient missed their medication because she is staying around 40 kilometers from the hospital. So she really depend on the public transport. And at the age of 70 plus, where she have difficulty in walking, and also her sight is not that good. So someone, or maybe her children, should be helping her for that particular moment, just to ensure that she doesn't miss the appointment with doctor. And medication costs. So some medication can be too expensive at times. So that's why we came out with the generic medication, where it will be a little bit more cheaper, and but the effect are the same. Let's say you have the original medication, so the price may be around 50 ringgit per box, but you can buy the generic one in around 5 to 10 ringgit, so you can save a lot of medication costs. So moving on to how to improve adherence. So first of all, to educate patients about what to expect. So if a patient starts to feeling better, he or she might think that the drug is no longer needed. Or if she feels the other way around, she feels worse or he feels worse about the medication, so the patient could discontinue therapy to avoid side effects. So for the first one, if they think they are feeling better, in terms of patient is taking antibiotic. So previously, I believe everyone has gone through this infectious disease, whatever it is. Maybe you have food poisoning, you have some URTI, upper respiratory tract infection. So once the doctor initiate the antibiotic, you can see the effect between 2 or 3 days, the earliest. Okay, but the duration of therapy might be 7 days. So after 5 days, patient can go home and will continue on oral antibiotics. So this oral antibiotic, you should always finish the course, because we might afraid that there will be antibiotic resistance, which is quite an issue nowadays since patient doesn't complete their antibiotic course properly. So nurture relationship with patient. So patient see and interact with their pharmacist actually more than the prescriber. So the prescriber usually diagnose, then they will just write whatever medication that is uh, need to be given for you for your particular disease. So actually the pharmacist gives more time, spends more time with you, since we need to counsel on how the medication need to be taken, how it is need to be stored. Okay, what are the common side effects that you need to see? Okay, and even the pharmacist also needs to follow up on how is the new dose, if the patient is taking a new dose. So do they have any new side effects, or they are feeling it is more better on the new dose? Okay, so number 3 is team up with prescribers. So good communication should have between prescriber and pharmacist, since sometimes like the second point just now, the prescriber having lesser contact time with the patient, and sometimes pharmacy have more contact time with the patient, so we might not know a little bit more on their history. So maybe patient is not that um, having that much of money to buy expensive medication, So we'll express all this to the prescriber, not to prescribe those highly high cost medication to the patient. Okay, so that's why we need to team up with the prescribers. And number four is to synchronize medication. Okay, so we try to coordinate all medication refills to the same pickup time of the month. So sometimes maybe we are running out of stock. So we are asking the patient, please come halfway in the month, maybe second week. Okay, so this might leads to non-adherence since the patient need to come multiple times to the hospital. If the patient has no underlying issues, no issues with transport, no issue with money and so on, so they can come to the hospital because they have no issue with anything. But if patient is having problems with transport, so if you are asking them to come twice per month, so it will be a burden to them. Okay, so for the last part, for my presentation, I will give one myth on medication. Okay, so the myth is medication will cause toxicity. Okay, so as a pharmacist, we have been doing our clinical trials. So just believe in us on whatever dose that has been stated in your product leaflet. So that is actually the safe dose. So one such myth is that paracetamol will stay in your body for longer than 24 hours. And in fact, there was one story in 2017 claiming that paracetamol can stay in your body up to 5 years. So if you are taking only one tablet, they are saying that paracetamol is going to retain in your body for 5 years. Okay, so in fact, according to the British pharmacology, paracetamol will be broken down in the body with the plasma half-life of 1.5 to 2.5 hours. So I'll explain a little bit on the half-life later. So while the rate of paracetamol is broken down depends on age and dosage, so studies shown that when taken as directed, paracetamol is eliminated from the body within 24 hours in healthy people. So within 1 day, actually, all the paracetamol has been eliminated from the body. Okay, so you can see that paracetamol is broken down depends on age and dosage. So that's why paracetamol dosing in children will be different from adult. So adult will take the tablet dose. Okay, so patient more than 12 years old, we can recommend 500 milligram. Okay, patient who are adults like us, so maximum dose is 1000 milligram per dose, which is at a interval of 6 hourly. So maximum dose will be 4 grams. Okay, so let's see what is actually half-life. So if you can see the first one, drug is taken at the first point, which is at the 0 point. So it will goes up by absorption and it will be at the maximum. So this Cmax is actually the highest concentration of of drug in your blood, and when it undergoes half-life of the drug, so you can see that the amount of drug in the blood will reduce by half. Okay, so let's see if patient is taking 500 milligram of paracetamol and the dose in the blood. Okay, this is just example, just to make sure you understand. So once it has been metabolized, it has been absorbed, so it will be available in your blood system, maybe 100 milligrams. Okay, so the half-life, let's say the half-life of paracetamol, we put it as 2 hours. So 100 milligram in your blood, after 2 hours, it will become 50 milligrams. So again, after 2 hours, it will become 25. So you will divide half by half for every 2 hours. So after certain amount of time, we can see that it will be at the least amount of number in your blood system. Okay, so this is what therapeutic level. Just to share with you, therapeutic window is the level it should be before it reaches toxic level, which is in red color, and subtherapeutic level is in yellow color. where it doesn't exert its full effect. So this is the range of dose that a person should have. If it's too much, it will become toxic. If it's too less, it will become subtherapeutic. So studies have been done. So no need to worry. Whatever dose that you are going to receive by the doctor. So we have done a lot of trials. Let's say the dose of paracetamol, just to lift up this myth. If you need to take 2 tablets 4 times a day, don't be afraid. It is in the green zone. It's not going into the red zone, and also it's not going into the yellow zone. So these are all my reference. So thank you. So back to you, Mr. Shutosh.
Thank you so much, sir, for this informative session. Definitely, our viewers from across the globe, we have viewers from so many countries right now, and I'm really thankful for them to be patient. And I hope you really got a wonderful session and knowledge from Mr. Kadir regarding adherence of medication. Few of the very important points he touched, like what kind of drugs actually contributes to medication, what are the behavioral aspects that contributes to medication adherence problem, actually non-adherence, I mean. So definitely, I know you have so many questions. Few of the questions we will be picking up here. First
Okay.
question is from Juan Bahia. Can the intake of supplement cause non-adherence to medication?
All right. So thank you for the question. So the question is, can the intake of supplement cause non-adherence to medication? So in Malaysia, I'm not generalizing all of the Malaysians, but from the place where I did my sort of not to say attachment in Kedah. So most of the patients are geriatric patients. So these geriatric patients do believe in supplements, where I can say this supplement is quite like a wonder drug. So one kind of supplement can treat all kind of disease. Okay. So even I have looked at the box itself. So behind the box, they say it can treat your hypertension, diabetes, asthma. So how come one drug can treat all the type of disease? So supplements can be an addition, but don't stop your normal medications. So please always contact your pharmacist just to ensure that the supplement you are taking doesn't have any drug-drug interaction or drug-herb interactions or any possible interaction that might worsen you later. Okay, I think that's all.
Okay, thank you so much. I think that is a good point. Like, what leads to supplement about the supplement thing. And previously, I think we have even done a webinar previously regarding supplements, how it do. So probably if public demand will be there, we can go back to other topics. You can even write your comments about what topics you want to choose. We will try to get back with some more interesting webinars. So, Mr. Kadir, I have another question here from Mr.
Okay.
Moreno. What
Okay.
are the common medication that will lead to non-adherence? Here you go, sir.
All right. So thank you, Mr. Mourinho. Okay, maybe he's a fan of football. Okay, so what are the common medication that will lead to non-adherence? Okay, so first of all, the common medication that will lead to non-adherence is the onco drugs, which is chemotherapy drugs. Okay, patient might have certain side effects. Okay, the common side effect you can see is alopecia. Okay, having nausea and vomiting. So upon these side effects, patient have the fear on taking on again the chemo drugs. They will need to treat their cancer. So other than that will be the anti-diabetic, which is your insulin. So patient doesn't or can't afford to buy the needle. So actually the needle is quite expensive. So patient doesn't follow up with doctor since they don't have proper Like I said previously, maybe they don't have proper transport to go to that hospital, and or they are from a poor family, so they can't buy all the insulin pen. Okay, insulin pen only be given once from the hospital. So let's say the pen is broken, so they need to buy by their own. So these are the common things that might lead to non-adherence.
All right. Thank you, Mr. Kadir.
All right.
So we have that's all we have questions for today. We will take up. So
Okay.
thank you so much, Mr. Kadir, for this wonderful session.
Okay, no
We will
problem.
see you again with some more interesting session in coming future. Right? So thank you
Okay.
so much. We see you again. So everyone, all of our viewers, I'm thanking you again for being patient and joining us today from throughout the globe. I'm again signing off. I'm Ashutosh on behalf of Faculty of Pharmacy, MAHSA University, which is located at Bandar Sojana Putra in Malaysia. It's in the state of Selangor, which is just nearby KL, Kuala Lumpur. So, you do have any queries, any topic related suggestion, or any question? We are live or not, doesn't matter. You can leave your questions here, and we will try to get back individually and give your answers. Okay. In future, if you have any interesting topic that you want to hear from us, you want us to share, and any idea, anything, please get back to us. For any further queries, our helplines are always there. We will see you again. Okay, have a good day. Enjoy.